Picture this. You're in the hospital. You lie quietly in bed until a nurse comes in with your towels and fresh pajamas. You dutifully get out of bed, trot off to the bathroom and have a shower while the nurse makes your bed with crisp linens. You return, slip into the starched sheets and wait patiently for breakfast and then doctor's rounds. The doctors come and they tell you what is wrong and what you need to do. And we, as your nursing team, proceed with that prescribed treatment. If this sounds like being the perfect patient, you are 100% right, if it was 1922. Things have certainly changed since then. And now, in 2022, so has our expectations of the perfect patient. We want patients to be highly active participants in their healthcare. Today, as a nurse practitioner, I'm going to talk about you, or more specifically, a particular version of you. You, the patient. No one ever wants to be in hospital, but the sad truth is, at some stage, you or a loved one will find you have become a patient. But rather than that being a passive experience where you think you should just do as you are told or have things unfold around you, there are many things you can do to help your healthcare journey. Some hints, tips, and inside knowledge, if you will, to help you become the perfect patient. But more importantly, to get well as soon as possible, because you are more in control of that, even in hospital, than you likely think. We all have to get out of the binary thinking that as a hospital patient, you should be passive, inactive, and even meek. Nothing could be further from the truth. And so I want to share 3 principles with you to help you become the perfect patient. They are to move, choose, and plan. But before these principles, however, there are another 3 things you should know about to set you on the path to becoming the perfect patient. And they have to do with your relationship with your nurse and the nursing team at the hospital. The first one is, remember your nurse's name. Nothing builds rapport faster than showing your nurse they are more than a conduit of care to you. Don't be frightened to ask them if you have forgot at any time. And if they haven't told you their name, ask them. Sadly, I know a number of nurses that don't introduce themselves to patients anymore as they have become resigned to forever being known as nurse. Don't let that be your relationship with your nurse. Next, be kind. You might think this goes without saying, but those in the healthcare profession are 5 times more likely to experience occupational violence than other workers, with up to 95% of healthcare workers reporting verbal or physical assault. In my career, I've been thrown backwards over an emergency department trolley, been threatened by a patient with a loaded gun, also been threatened with being stalked outside of work and sworn at more times than I can remember. I'm still here though. All it takes is seeing the difference that I make in someone's life to keep me coming back. And I know that most nursing staff, despite all we go through, are the same. Finally, in relation to key things to know about nurses, we've seen it all. So please don't make up stories to cover up the causes of any injuries you wouldn't be proud to tell your mother about. Here's a little secret. We don't care you decided 4 beers in to tie a sheet around your neck like a cloak and jump off the roof and glide down dramatically Batman style. We care that you fell from that height because of what hidden injuries you may have that we aren't aware of yet. Saying that you slipped and fell just doesn't quite ring the same alarm bells for us, and we might miss something. We don't want to miss a thing for you, so please own up to your Batman escapades and we won't flutter an eyelid. Now onto the principles of being perfect patient. The first is move. Whilst there's certainly times when you need to rest in bed whilst in hospital, more often than not, you do not need to. And in fact, it is far better for you to move as often as you can. It is not unusual for patients to spend 83% of their time in bed, 12% of their time sitting, and only 5% of their time mobilising. At the hospital I work at, we've implemented a program to fight PJ paralysis. By encouraging patients to dress in day clothes rather than pyjamas, we aim to shift the perception from "I'm sick" to "I'm getting better." If the nurse asks you to sit in a chair or go for a walk, they're doing it for a very specific reason. They aren't trying to be cruel. They're trying to lessen the time you spend in hospital. To move is to heal. The longer you remain in bed, the longer you remain in hospital. The longer you remain in hospital, the more likely you are to pick up a bug and become sicker than you already are. You don't want that. We don't want that. So you need to move. When you think about what to pack for hospital, don't load up on pyjamas. Pack some comfy clothes instead. There are so many more places to hospital than just your room. There are outdoor areas, cafes, and quiet reflective spaces. Places where you can go and spend some time away from the ward. But a word of warning here. Please make sure your nurse is aware you are leaving the ward so they know where you are should you be needed for treatment or review. Carry a mobile phone with you so the nurse can get in touch. This is important because, trust me, the nurse will get in trouble if they can't find you when you're needed. And now it's time to choose. This is all about being active in your healthcare. It's great if you have a wonderful rapport with your GP and they tell you what medications you need to take and what you need to do, building trust as the holders of your healthcare needs in the community. That doesn't help us, however, when you get to hospital. You need to know what medications you take or those of a loved one that you're speaking for and what you or they take them for. A number of medications have multiple uses. Don't make us take off our nurse's hat and put on a detective hat. Tell us everything. Even if you don't think we need to know, we probably do. When we ask your past medical history, give it all up. Don't make us ask what that scar is to find out you had an organ removed 10 years ago. Even though it's in your past, it could be quite relevant now. If you're unsure what is happening or the decisions you need to make, ask questions so that you can be confident in those decisions. A hospital contains a lot of moving parts. I know from your perspective, it seems like the doctors tell you that you need a scan, you agree, and then a short while later you were taken for that scan. But a lot of things will have happened in between the ordering of that scan and you arriving to have it. The doctor will often have to convince those responsible of the level of urgency required for that scan. Patients will have their booked appointments delayed to fit you in. When we come and get you and take you for that scan, only for you to then tell the person performing it, "I don't want this," a situation emerges that could have been avoided a long time before then. Now, let me be clear with this. I will die defending the hill that is patient choice and the patient voice. And there are people like me in every hospital, more of us than you may think. If you tell us what you want, we will bend over backwards to defend your right to choose. We will make sure your voice is heard. You just need to let us know what it is that you need. If you don't want to have a particular test or therapy, speak to us. There could be other options we could use, or we could explore your reasons for not wanting something. There's nothing we don't want to hear about your needs, whether they be about your routine, yourself, or your healthcare choices. But you do need to tell us, because otherwise we hear nothing. Ask questions. If you are unsure when you need to make a decision, one of the best questions you can ask is, what would happen if I don't do anything? You would be amazed at how informative the answer can be. Finally, the principle of plan. Now that you've been busily moving around the ward and being an active participant in your own healthcare, what is left to do to be the perfect patient is to think about who can tell us what your wishes are in relation to your healthcare needs if you don't have a voice. There are many reasons why you may not be able to express your wishes in a hospital setting. From temporary conditions such as being unconscious from the earlier Batman escapade, or something more permanent like the cognitive decline often associated with stroke or dementia. And it is heartbreaking seeing the anguish on the faces of loved ones as they are trying to make decisions on behalf of somebody when they don't truly know what that person wants. This is a big part of what I do, talking to those responsible for making decisions for other people while they're in hospital. And there is a remarkable difference in the confidence when those people are making those decisions safe in the knowledge of what that person wanted in comparison to those who don't. So please talk to your loved ones, your family, your doctor, and make sure that your wishes in regards to your healthcare needs are clear. Let me tell you about my perfect patient. They came into my professional life when I was working in the emergency department. I'd only been working for 2 or 3 years as a nurse, and clearly, at this tender stage of my career, I, of course, knew everything. A gentleman came in on an afternoon shift complaining of chest pain. He was allocated to my cubicles and I hooked him up to monitors. A little while later, his heart suddenly stopped. As alarms were going off, I raced into his cubicle and after assessing the situation, commenced CPR. This continued for a considerable amount of time, with me astride him on the trolley at one point as it was being wheeled into the resuscitation bay. We got his heart started again and he was transferred to the cardiac unit. Job well done, life saved. 3 months later, he came back into the hospital. By pure chance, he was allocated to my cubicles again. I introduced myself to him again and he said to me, "I remember you. You're the nurse that looked after me last time, aren't you?" I said yes, and immediately prepared myself to respond to his gratitude for saving his life. I may even have puffed up a little in anticipation. He followed up with, "Yes, you made me that really great cup of coffee." Why is he my perfect patient? He taught me something that has stayed with me my entire nursing journey, and that is, it's the small things, the very small things that people truly appreciate. Oh, and who makes the worst patient? Without a shadow of a doubt, the worst patients are nurses. No hesitation in saying that at all. Of course, we all know that there is no such thing as a perfect patient because there's no such thing as a perfect human being. That type of binary has had us in trouble with ourselves and each other for a long time now. However, to be on the path to being just an exceptional patient, always remember to move, choose, and plan. Not only will those things help you get better sooner, they may even save your life. Oh, and from a dedicated and experienced nurse, one final point before I go. Hospital gowns. Please remember, folks, the opening always goes to the back.